Okay, part of our shoulder mobility routine and also our thoracic mobility routine is we want to mobilize our thoracic spine into extension. To do this, you just need a foam roller. I like to support your head. Make sure your elbows are together and your arms aren't laid out, but keep your elbows together. You're just going to kind of oscillate over the foam roller in extension. Move up a segment. I like to keep my core engaged and my ribs down. You don't want to be flaring your ribs too much or lifting your hips up off the ground. Just trying to isolate the segment that's on the foam roller. And free up your thoracic spine into extension. Alright guys, you've done a little foam roller extension work. Now we're going to work on rotation. Use a foam roller here to put pressure into with your knee, downward pressure. You can use an ab mat just to support your head. Arm out to the side. We're going to do some thoracic rotation. You can use this hand to help pull yourself over. If there's a particular area of your T-spine that seems to be getting stuck, you can use your hand to help mobilize that specific spot. You'll do 10 to 15 reps of that. If you had an asymmetry where one area was tighter, maybe it was left thoracic rotation, maybe right, you'll work on that area until you're even. If both sides were restricted, you'll do this bilateral. Alright, to start our pelvic tilt mobility progression, you're going to see in a lot of your athletes that are restricted with pelvic tilting that they're really dominant in their lumbar extensors. They'll have real strong, meaty lumbar paraspinals here, and they're kind of locked in this anterior pelvic tilt, so they can't really posterior tilt, or they're real shaky. So we need to inhibit or turn off these lumbar extensors and stretch them out a little bit. A good way to do that, have them on their knees, posteriorly tilt as much as I can, sit back on your heels, come down onto your forearms. In that position, you'll take a good breath in, and then on the exhale, round the back. Hold that rounded position, do another cycle of breath, and again, when you exhale, even more lumbar flexion. So it'll look like this. Good exercise to turn off those lumbar extensors and start freeing that pelvis up for pelvic tilting. Okay, this is an active thoracic rotation exercise. To do this, come down onto your forearm. With this arm, you want to try to reach your fingers as far to your spine as you can. From here, you're just going to rotate, come back, touch, rotate. Try to keep your head at the same spot. You don't want to be shifting laterally. Touch, rotate, touch, rotate. This is an active thoracic rotation exercise. You'll do 5 to 10 reps of that. The next rolling pattern we're going to look at is going to be the flexion upper extremity rolling pattern. It'll look like this. That's your upper extremity flexion rolling pattern. Alright guys, we're going to do some rolling patterns. Here we're going to do some prone to supine upper extremity rolling patterns. You want to use only your upper body. Don't allow the athlete to use the lower body at all. It'll look like this. That's the upper extremity prone to supine rolling pattern.